Today, as I was saying earlier, we are going to talk about listening part A, the technique. So the steps we should take during the exam. So I'd like to start with some activities related to the vocabulary we're going to have today in our listening. Now, the first activity is a matching activity, and it's actually pretty obvious. I haven't added letters and numbers. I'm going to do it now. So in the chat, because hi. In the chat, I'd like you to write the corresponding letters and numbers for the word and the definition, the phrase and its definition. So which one is which? It's very short and it shouldn't be too difficult, you know. A bladder infection and a urinary tract infection. Which one is which? Two answers. One of the two answers is correct. Two of the three answers are correct. So, yes. Indeed, we have one with A with two, sorry, a bladder infection is most often caused by bacterial infection within the bladder, and a urinary tract infection, B, is with one. So now you actually get a bit of an idea of what our listening is going to be today. So A with two and B with one. Good. Now, let's think of some synonyms for the following words. Okay, let's think of the synonyms, and then we're going to discuss why we need to think of synonyms. So, onset. Do you know any synonyms for onset? What does it mean? So please write in the chat a few synonyms, or at least one, or maybe the definition of onset. Yes, so start, it is indeed, not disturbed, but start it is. Arrival, yeah, can also be a synonym. I am not writing them because on the following page, I have the answers. And so I'm going to send you this document and you're going to have the answers at home and you're going to have more synonyms there. But just to go through them now. Yes, so start, beginning, arrival, yep. So this is the meaning of onset, start, beginning, arrival, and so on. Okay, abdomen. Words, synonyms for abdomen. Yes, belly, stomach. It is tummy, but with the letter U, the sound so tummy, yes, that's the one. It's not the chest. The chest is up. The tummy is down. So indeed, we have stomach, belly, tummy, intestines. Okay, depending on context. Now, the next word is cloudy, but not for weather, but for a liquid. So if a liquid is cloudy, what does it mean of a liquid? It's cloudy. Yep, it's not clear. Any other synonyms? Well, indeed, we don't have to diagnose to have the diagnosis now. It is an infection. It might be urinary tract infection. Yeah, we have them above in the previous activity. But synonyms, I'm just interested in synonyms. So not clear, non-transparent, dirty, dull. There are different ways, yes, but that is the meaning. Opaque, yeah, that's the one. Okay, so we have different synonyms just to understand the meaning of the words. And the last one is urine. A few synonyms for urine. Yes, pee is one of the synonyms. Do you only know one? Type 1. Okay. How do children refer to we when they said it? So children say we, yeah, not only children, of course, but they use this term, we, okay. So, yep, these are some synonyms. Now, we are going to look at listening part A. Some of you have studied listening part A before, some of you haven't. Now, why do you think I wanted us to think of synonyms? Why do you think I wanted us to start by thinking of synonyms for these words? Indeed, for listening, but why? Why do we need synonyms? Or maybe definitions or understanding concepts or rephrasing certain concepts, saying with other words. Yeah. So, yes, this is an important activity for all the parts of the exam, not only for OET, also for IELTS, because you show that you have a good level of language, yeah, if you know how to say a word in many different ways. Now, in listening part A, you are going to listen to a recording, and then you're going to see some words on the paper. They are not the same words. You're not going to hear the words you have on the paper. You're going to hear synonyms or explanation or phrases related to that concept. That's why you need to know many ways, many different ways of saying the same thing. Okay, now I'm going to stop sharing this and I'm going to go to our listening part A for today. So, in listening part A, I'm just going to ask you, let me just get my chat back here. Sorry. Okay, so what do you know about listening part A? Juliana, are you here?
Yes, morning.
Okay, sorry, but well, you know. So what do you know about the listening part A? What do we need to do? How many questions are there?
12. 24 actually. There are 2 texts.
Yes, 2 recordings. Okay.
Recording.
And each recording has
12
questions.
questions.
Yeah, 12 questions, let's say. And the total for part A is 24.
Yeah.
Okay. What's the minimum I usually recommend to get when we practice? What's the minimum score? How many correct answers should you have? The minimum number of correct answers, do you know?
A or listening?
The whole part A. Well, for the whole part A, I'd like you to try to have at least 20 out of 24, okay? At least 20 out of 24. The more you have, the better. Okay, thank you. You can mute your microphone now. So in listening part A, we have 2 recordings. These recordings are dialogues between a patient and a medical professional. Now, it might be a nurse or a doctor or physiotherapist or cardiologist, or it doesn't matter. The listening and the reading are the same for all professions. That's why the focus is going to be on what the patient says. We might have some answers from what the medical professional says, but most of the answers, about 90% of the answers, are going to come from the patient. But we do need to listen to everything that's being said. So you have 2 recordings. Today we are going to do one of them, and each recording, like the one we have here, has 12 gaps. Now let's read a bit the introduction here. So you hear a GP talking to a patient, namely Saka, for questions 1 to 12, complete the notes with a word or a short phrase. Now you can have a word or a short phrase, 2, 3, 4 words. The average is usually about 3, 1, 2, 3, but please consider the fact that it might have more words, 4 or even 5 in certain contexts. Now, listening part A is nicer, let's say, than reading part A, because certain mistakes are allowed, like spelling mistakes or certain grammar mistakes. So if you get the word, but you write it more or less with the pronunciation, but you get the word and it doesn't look like another word, it's not confusing, those spelling mistakes might be accepted or will be accepted. Now, when you work at home, as I was saying earlier, you should try and aim for 20 out of 24. That means at least 10 correct answers per recording. Now, what we're going to do today is discuss how we should tackle this part A of the exam. So just by looking at what we have here, what do you think? Let's see if you know, or what do you think the correct method is to address part A? What should we do from your point of view? You can write in the chat. What should we do first? You get the paper, you have the questions, and of course you read. Do you know how much time you have to read the questions before the recording is played? How much time do you have to read this whole page before the recording starts? Oh no, that's too much. Not 5 minutes. No, no. 30 seconds. You have 30 seconds to read this page, and then the recording normally starts. Okay, so only 30 seconds. That's why you need to know what you need to do. So what do you think you need to do first in those 30 seconds? What should you do first in those 30 seconds? Well, you know, this is not a very big text. So some techniques, some techniques are not, could not apply here. Yes. So we always start by reading those titles on the left. Yeah. So everything that is in bold, you start with these: patient, symptoms, possible causes, background details, current condition, and medications. So that's the first thing you need. Why do you think you need to start by reading this part? Why do you think? So you don't focus on this part at first, you only focus on this part here. Why? Let's So this reading at first, the left side will help you, yes, understanding the context and knowing the order of the dialogue, because not all the dialogues are going to have the same topics and they're not going to have the same structure. You won't find symptoms before causes. You won't find medications last. So in case during the recording you get stuck, you have a moment, you panic, let's say, and then you come back to your senses and you want to continue, then you should know where you are. Yeah. So this helps you understand the structure, the context, the order of the dialogue. Okay, now after reading this part, of course, if we move on to this part, should we read every single line? Should we read everything? What do you think? Should we read everything or not? You can just type yes or no. Should we read everything here? Yes or no? Oh my God. Yes. The answer is yes. You should read everything. Now, I know you at this point you think, but I only have 30 seconds. How am I going to read everything? Fast and really fast. So you should read everything. These lines that don't have any gaps will help you again learn about the structure of the recording and the way the information is presented, the order the information is presented. So for example, if you get to this part, okay, something happens, you just get stuck, and at one point you hear may have resulted from avoiding urination, and you haven't answered these questions from 1 to 5, they're gone. Bye-bye. You won't get them back. But you know that you need to focus on the rest of the recording, okay? So you should read everything, because if you get stuck, if you just have a moment of panic and you don't hear, you don't see anything, when you come back, yeah, when you're calm again and ready to work, these will help you know where you are within the recording, yeah? So you read everything. Now, of course, when you read, you should read the whole line to the end, okay? Because some words might help you. So don't just stop here, blah, 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 sensation. Just read to the end. Now, when you read all these lines, all the list, when you read all the list, you should also think of synonyms and the concept you have. Now, especially if you do this at home and you're just practicing for the exam, you're just learning about listening part A, you should look for definitions, you should look for synonyms. That's why we started with the previous two activities, so you can get a better understanding of the recording and what's going to happen. So always think of synonyms, always think of definitions, always think of meanings, of the way some words might be said within the recording, because we know we are not going to hear all the words in the same way. We can see them here in a way written, but we might hear their synonyms, so we need to be prepared. Okay, so you're reading line by line by line by line. While you read, you think of words. Now we know lower abdomen, yeah, it's not just abdomen, it's lower abdomen. So we can think of a synonym again. Then some pain. Maybe the patient will not say, I have some pain. Maybe the patient might say, it hurts. Yeah, normally patients might say, well, it hurts here or it hurts there. So try to think of ways the patient might say the information on the piece of paper. Okay? Good. Now, you read everything on the left, then you read everything on the right, and while you read, you also think of synonyms for the words you see. Now, what do we need to do with the gaps? Is there anything we should do when we read and we reach one of these gaps? Could you please write in the chat, what should we do? Okay. Yes, think of an answer. So there are two things you need to do. It's okay, don't worry. So there are two things you need to do. The first thing is to think what part of speech you have, okay? What part of speech? Is it a noun? Meaning, is it a part of the body? Is it a job? What is it? Is it a noun or not? Is it an adjective? Is it a word describing something, okay? Or is it a verb? Because when you listen to the recording, you might hear the word, but because there are many words and they're talking really fast, you might write down something similar, but you need to write an adjective if it's a description, or if you need to write a verb if it's an action, okay? So first of all, you should think of the part of speech, okay? Is it a noun? Is it an adjective? Is it a verb? And then you should try and guess, brainstorm what vocabulary you might have there. Maybe it's a part of the body. Maybe it's a type of pain. Now, this one is a bit tricky, employed in, well, we don't know where this person works. There are many possibilities. But obliged to wear, yeah, inconvenient to remove. If it's obliged to wear, it might be a piece of equipment. It might be uniform. It might be a certain belt. So you can brainstorm ideas for the words. You can try and think of a piece of vocabulary that might go there. For example, some pain in the blah, blah, blah also. Do you think on this little line here, what do you think should we have? A noun, a verb, or an adjective, or anything else? Some pain in the blah, blah, blah. So it is indeed a noun, and it might actually be a part of body. Yes. So, of course, there are many parts of the body, but at least it's not the whole vocabulary. You know, here I need to listen for one part of the body. Okay. Experiences a blah, blah, blah sensation on urination. Blah, blah, blah sensation. What do you think? What part of speech do you think we should have here? A noun, an adjective, a verb? So it seems that we'll find, we'll have something describing, a descriptive word. So in this case, an adjective, okay? If it describes something, it should be an adjective. It describes a noun, of course, an adjective. And then you can start and brainstorm ideas. What type of sensation could you get on urination? Let's try and brainstorm some words. What type of sensation might you have on urination? Yeah, maybe burning. You might we are looking, see, pain could be okay, but we're looking for an adjective, not pain. It might be painful. Yeah. So this is what you should do. Sharp, okay. This is what you should do during those 30 seconds. Now I'm going to go back to our Word document and just write down the steps, and then I'm going to actually play the recording and you are going to try and get the answers. 1 second, please. So, steps. 1, read everything. I will try and make it as simple as possible, yeah? Read everything on the left, all those bold titles, everything in bold. 2, read everything on the right, all the list, all those little dots. 3, while you read, think of synonyms. You can even think of antonyms. Yeah, maybe maybe the patient might use an antonym or something. I'm not feeling that, I'm feeling that. Words we could use to describe, to explain, rephrasing might be used here. Okay, and then when you look at the gaps, there are 2 things you need to do. 1, think of a part of speech. So is it a noun? Is it then an adjective? Is it a verb, an action? Is it an adverb? What is it? And then try to brainstorm ideas for the vocabulary, okay? Try and narrow it down, let's say, to a certain piece of vocabulary. Sorry. Okay. Now, these are the steps. What I'm going to do now is you will have only 30 seconds, okay, to read, just as you would in the exam. I'm going to start the timer, and you're going to have 30 seconds to go over the page and do what we've discussed. Are you ready? So start reading now. 30 seconds to read. Stop.
Been to this medical practice before, Lisa?
I have, yes. Probably about 3 months ago.
Okay, that's good. It means that you're in our system. So, what brings you in today?
I think I may have a bladder infection. I've got a sort of feeling in my lower belly, a sort of cramping. It's like there's a heavy pressure near my bladder. It's hard to describe. I also have some pain around here in my lower back.
Right.
It's kind of like period pain, but I finished my last period about 2 weeks ago, so I don't think it's related to that. That was on the 16th. The main thing is it feels like I have to pee every few minutes. I always seem to have the feeling that I need to go. There's also a bit of a burning sensation when I do go, so that kind of makes me not want to put it off, if you know what I mean.
Yeah.
The pain isn't too severe, but it's enough to make it uncomfortable. The pee seems to be a bit cloudy too, and well, it's a little embarrassing, but it has quite a strong smell.
What you're describing certainly fits with an infection. It's a common condition and it's treatable with antibiotics. What's your understanding of what may have caused it?
I was reading online about it actually, and I know you can get it through lots of ways. But I'm not in a relationship right now, so I know it's not from anything sexual. I don't get to go to the toilet very often at work, and I read how holding it in can actually bring on an infection.
It's possible, yes. May I ask, what kind of work you do?
I work in a factory. The work's easy, nothing strenuous, and my co-workers are great. And our boss actually lets us go to the toilet whenever we want to. The problem's more that I have to put on a protective suit as soon as I get in and keep it on all day. It's kind of inconvenient when you need to go to the toilet. It means unsuiting, then going, then resuiting. It's a lot of effort, so you tend not to bother.
Right.
Actually, we've got a routine. We hardly drink anything before lunch and then nothing at all at lunch. If you don't drink, you don't have to go to the toilet. It's simple and it works for us. I always have a beer after work, in the evening, so I keep my fluid intake up generally.
Well, dehydration and also holding it in for long stretches can certainly be a factor. How many times would you normally urinate throughout the day?
Usually, I don't know, maybe 2 or 3, sometimes not at all. After work, it's usually once, so I'd say 3 times altogether.
Mm-hmm.
But since the symptoms started, I'm having to go at least 10 times a day, and sometimes more. And it's just such a small amount, but I still have what I can only call a strong urge to go. It's annoying to have to go through all the undressing and dressing, just for that, and so often.
Are you taking any medication at the moment?
Not really any medication for health reasons, but, I'm on the contraceptive pill. I've never had any problems with it, though. and I've been on that for about, or it must be 2.5 years now. I also take Panadol if it gets too painful. Do you think it's possible to get the antibiotics for this today, Doctor? It's really driving me crazy.
All right, the first thing we need to do is take your urine sample. This will give us a good indication of what we're dealing with. You'll need to get a midstream sample to be accurate.
Wow, what was that? So, at home, I'm going to send you this PDF with the questions. Then you have the transcript, and I just highlighted the answers. But now we're going to go and look at the answers together. So have a look at the answers, and then please tell me, you can tell me in the chat, how many correct answers you've had. Out of 12, how many correct answers do you have on your piece of paper? So, cramping, lower back, burning. Now, for 4, yeah, if you have words between brackets, the words between brackets can be there or not, it doesn't matter, but you need to have all the words that are outside of the brackets, like smell, factory, protective suit, beer, strong urge, contraceptive pill. Now, if you have strong or a or the, that's okay. So, we have 7, 11, 10, 5. Some words weren't, it's a plural. Okay. What do you mean, no many things sexual? It has to be only sexual. If it's another word, or if you have more words than sexual, it's not correct. Okay. So this is our activity. No many things sexual. No, sorry, just the word. If you have more words than that, they're not just going to take to think, oh, okay, he also has the correct word included. No, you need to have just this word, or it doesn't matter. Okay, guys, so I'm going to send you this PDF. I'm going to send you, so the PDF has the activity, has the transcript and the answers. I'm also going to send you the recording so you can listen to it again at home. Please look for any unknown words and listen again and try to see why, what was the reason, and that's what I'm actually going to ask you now. Why, what was the most difficult part for you? Was it the accent? Was it them talking too fast? Was it, for example, some students say, I understand everything, but I don't have the time to write. Everything, accent, too fast, writing as this at the same time. Yeah. Okay. So I'm going to stop this recording now. Too fast. Yes. So what could you do before I stop the recording? What could you do to train your ear? What could you do? Because just practicing for the exam doesn't help. Okay, you should listen, of course. What could you listen to? Yes, so there are many, many different things. You can listen to the radio or the TV. You can listen, of course, to medical podcasts. Yep. Do you know about graded readers? Have we talked about graded readers? Now, graded readers, and especially if you choose from Oxford, I think the other ones have tests too. Graded readers, we have books, classical books, or with more up-to-date vocabulary and stories, and they're on different levels, like you have graded books for elementary students, pre-intermediate, intermediate, upper intermediate, and the advanced, of course. So these books are adapted to a certain level of language. They have less grammar concepts and easy vocabulary for the lower levels, of course. These books can also have recordings, so you can read the book, you can listen to the book, you can listen and read at the same time. So just yesterday, I sent this to a student, and I know Oxford also has a test, a very short test, to see which level suits you. So you could try also these type of books, graded readers, meaning books adapted to a certain language level. So radio, TV, medical podcasts, graded readers, there are many things you can do. And of course, if you're a Netflix fan, you don't use subtitles, okay? Sorry, no subtitling. No, not English, not Romanian, not any other language. Just listen. Okay, I'm going to stop the recording now.